Hi everyone, thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and science so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and your hometown with your questions. I'll pick a few questions each week to discuss in the vlog. Our first question comes to us from Tracy from Chelmsford. When can we expect to see COVID-19 booster shots approved for kids 12 to 18 years old? We're coming up on 6 months since the vaccine first became available to this age group. And with the holidays approaching and the possible end of a school mask mandate in January, it seems important to boost the immunity in this population. Tracy, I have to admit this isn't a question that I've really given much thought to, and perhaps I should have. You know, Israel is offering boosters to children 12 and over, but the company hasn't studied boosters for adolescents. And given their very low risk of severe complications after receiving a 2-dose series, and the fact that 16 and 17-year-olds are at highest risk for the rare side effect myocarditis or inflammation of the heart, I'm really not sure the FDA will be ready to authorize boosters for them soon. You know, there will always be vaccine breakthrough infections, but as long as vaccines are preventing the worst complications from COVID-19, like severe disease and long COVID, which they do, we're still way better off than we were a year ago. Our second question comes from Felicity from Yarmouth. I saw that COVID-19 cases are trending up again in Massachusetts since Halloween. Here in Yarmouth, we had one of the highest positive test percentages in the state this past week. Should we be concerned? Well, Felicity, I won't sugarcoat it. The state's numbers are not awesome. Cases and percent positivity are up. Hospitalizations, much less so. Our high vaccination rate is not going to prevent the seasonal phenomenon of rising cases in winter. But I think it will keep hospitalizations largely at bay. You should be aware that there is more risk out there than there was a couple of weeks ago, and a lot more than there was in June. Your vaccine will likely protect you from the worst complications of COVID-19, but if you're eligible for a booster, this is the time to get one. Our last question is from Jerry from Natick. Are there advantages of the Moderna or Pfizer COVID-19 booster over the J&J booster for people with various pre-existing medical conditions? I had the J&J vaccine back in March, and it triggered my polymyalgia rheumatica with stiffness, aches, and flu-like symptoms. I prefer to avoid repeating that experience again. Hi, Jerry. I'm so sorry that you felt crummy after your J&J vaccine. Unfortunately, all 3 vaccines can cause you to have a day or 2 of side effects. The good news is it means the vaccine is working to rev up your immune system to recognize the virus. Now, there are a few medical conditions and risk factors that should make you consider one vaccine over the other than, of course, being allergic to one or the other brand. First, women under the age of 50 should consider getting the Pfizer or Moderna vaccines rather than the J&J vaccine, since the very rare side effect of blood clotting with J&J has been seen in younger women. Now, if you've had an immune-mediated condition characterized by clotting and low platelets in the past, you should not get J&J vaccine. Heparin-induced thrombocytopenia is the name of one of those conditions. People with a history of Guillain-Barré syndrome also might want to get Pfizer or Moderna rather than J&J, since J&J has very rarely been associated with that condition. If you've had it, you know it. And males under the age of 30 might consider getting boosted with J&J rather than Pfizer or Moderna, since J&J is not associated with myocarditis or heart inflammation, which is a very rare side effect of Pfizer and Moderna that is mostly seen in younger males. That's all for this week. You can send me your questions about the pandemic, this year's flu season or anything else related to infectious diseases to a dose of reason at tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.